Have you ever felt that moment when your body suddenly changes, and you can't quite explain why the joints that carried you through decades now feel heavier, tighter, or more painful than ever before? A patient once sat across from me and said, "Dr. Carter, I was perfectly fine at 58. Then at 62, it felt like every joint in my body turned against me overnight." I want you to imagine this with me. You wake up one morning thinking it's just another ordinary day, but as you stand, a sharp stiffness runs through your knees or your hips or your hands, and you pause, wondering, why now? What changed? Myas ACATES. I've spent more than 30 years caring for adults over 60, and one thing I've learned is that this sudden surge of joint pain rarely comes out of nowhere. It feels unexpected, unfair, and for many people, frightening. But here's the part most seniors never hear. The increase in joint pain after 60 is not simply age catching up with you. It's not the universe punishing you for getting older. It's the result of hidden factors that have quietly been building inside the body for years, sometimes even decades. In today's video, I'm going to walk you through what actually changes inside your joints after 60. We'll talk about why cartilage begins to thin faster, why the body produces less natural lubrication, why inflammation becomes more aggressive than it used to be, and yes, why women often experience more severe joint pain than men. You'll begin to see that this pain isn't random at all. It follows patterns that make perfect sense once you understand how the body works. But before we go any deeper, I want you to hear this from me as clearly as possible. Joint pain is not a sign that your body is giving up. It is your body speaking to you. It's asking for support, for alignment, for gentler movement, for better circulation. And once you know what your joints are truly asking for, everything changes. You regain confidence, you regain control, and you regain hope. So stay with me. In this video, I'm going to share the real causes most doctors don't have time to explain in a quick appointment, and the simple, practical solutions that have helped countless seniors feel stronger and move with more ease. If you want to understand your body, reduce your pain, and stay independent as you age, make sure to watch until the end and subscribe to Senior Health Daily for more expert guidance every week. Why joint pain surges? After 60. As we continue this journey together, I want to take you inside the body and show you what truly happens to your joints after 60. Not in a complicated medical way, but in a way that helps you finally understand why your pain feels sharper, more frequent, or more stubborn than it did years ago. Once you see the biological triggers clearly, you begin to understand that your pain has logic, patterns, and causes you can work with, not fear. Let's begin with one of the most important changes. After 60. The cartilage that covers your joints starts losing water. Cartilage is like a soft cushion at the ends of your bones. When it's hydrated, it absorbs shock beautifully. But with age, that cushion becomes drier and more brittle. I've heard many seniors describe the same feeling. It's like bone rubbing on bone. In a way, they're right. Once cartilage thins, your joints lose their natural padding, and even simple movements like standing up, stepping down, or reaching for something can feel painful. Another big change is the decline in synovial fluid. This is the slick, silky lubricant inside your joints that lets you move smoothly. When you're younger, your body produces plenty of it, but after 60, production drops noticeably. Without enough lubrication, the joints stiffen, and people often say to me, "I feel rusty in the morning," and that's exactly what it is. A joint without fluid behaves just like a hinge that hasn't been oiled in years. Then there's inflammation. As we age, the immune system becomes more reactive. Instead of fighting only what needs to be fought, it stays slightly activated all the time. That low-grade inflammation sits quietly in the background for years, until one day you start feeling the swelling, the heat, the stiffness. Many seniors think it appeared overnight, but it didn't. It was brewing silently, waiting for the right moment to reveal itself. And we can't forget the ligaments and tendons. These are the supportive ropes that hold your joints stable. With age, they lose elasticity. They don't stretch and rebound the way they used to. That lack of flexibility increases friction inside the joint. Imagine a rubber band left out in the sun. It becomes stiff, fragile, and easier to snap. That's very similar to what aging does to connective tissues. Lastly, muscle loss plays a huge role. After 60, the body naturally loses muscle mass unless you actively fight against it. Weaker muscles mean less support for your joints. The pressure that should be carried by muscle shifts directly onto bone and cartilage. When that happens, every step, every bend, every twist becomes harder on your joints than it needs to be. All these changes together create the perfect storm, which is why the surge in joint pain often seems sudden, even though it was building quietly for many years. But understanding these changes is the first step toward taking control again. Once you know what's happening underneath the surface, you can begin addressing it in smart, gentle ways. Lifestyle factors that build up for decades. When we talk about joint pain after 60, it's easy to point to aging as the only cause. But aging alone is never the full story. In truth, most of the pain my patients feel at 60, 70, or 80 is the result of habits, postures, and small choices repeated quietly over decades. These patterns are so subtle that most people never notice them until the body speaks up loudly. Let's start with posture, something almost everyone underestimates. Years of leaning forward at a desk, lifting children, carrying bags on one side, bending over laundry, or simply sitting with rounded shoulders slowly reshape the way the body distributes weight. I've watched many patients walk into my office with their heads sliding forward and their knees locking back without even realizing it. Over time, these misalignments cause uneven pressure inside the joints. It's similar to a car whose wheels are slightly out of alignment. You can still drive it, but the tires wear down unevenly and much faster. Your joints react the same way. Then there are old injuries, the ones you thought were long forgotten. A twisted ankle from your 30s, a knee sprain in your 40s, a fall in your 50s. Even when the pain went away at the time, the structure of the joint often changed. The body compensated. One muscle tightened to protect you and stayed tight. Another weakened and never fully recovered. These small, hidden imbalances can return decades later as inflammation, stiffness, or recurring pain. Many of my patients are shocked when I explain that today's knee pain may be connected to something that happened 20 or 30 years ago. And then we have the effects of a sedentary lifestyle. We sit more now than any generation before us. Long periods in chairs, recliners, and cars slowly reduce muscle strength and limit the flow of nutrients to the joints. The joints are meant to move. Movement is how cartilage receives nourishment. When movement is limited for years, the joints aren't fed properly and begin to deteriorate faster. I often tell my patients, it's not your age that stiffened you, it's the years you spent not moving enough. Weight gain also plays a tremendous role, especially after menopause or retirement, when hormonal changes and lifestyle shifts collide. Even small increases can dramatically affect joint health. Most people don't realize that every extra pound of body weight adds an additional 4 pounds of pressure on the knees with each step. If someone gains just 10 pounds over the years, their knees may carry 40 extra pounds of force every time they walk. That accumulated stress accelerates wear and tear. Dehydration is another silent contributor. Seniors naturally feel less thirsty, so they drink less water. But joints rely heavily on water to stay flexible and cushioned. Without adequate hydration, cartilage becomes dry, synovial fluid thickens, and movement becomes harder. Many patients tell me their pain worsens on days they drink very little water, and that's no coincidence. And of course, decades of overuse take a toll. Whether it's years of manual labor, repetitive housework, gardening, or even standing for long hours, the body remembers everything. Joints that are overloaded repeatedly eventually begin to protest, not suddenly, but gradually, until one day the discomfort becomes impossible to ignore. When you combine all these lifestyle factors, you begin to see why joint pain after 60 feels like it arrives overnight, when in truth, It's the result of a lifetime. But here's the hopeful part. Because these factors developed over time, the solutions we'll talk about later can also reshape the body over time. Small daily improvements can undo years of wear, restore balance, and help you move with greater comfort. Why women experience more joint pain after 60. As we move deeper into this conversation, I want to talk directly to the women who are listening, because the truth is that women over 60 experience joint pain at much higher rates than men. I've seen this pattern in my own patients year after year, and it's not your imagination. It's not weakness, and it's certainly not something you caused. It's a predictable combination of biology, hormones, structure, and life experience that all converge after 60. Let's start with the most significant factor: estrogen. Estrogen is an extraordinary hormone. Most people think of it only in terms of reproduction or menopause, but its influence reaches far beyond that. For decades, estrogen has quietly protected your joints. It keeps inflammation down. It supports cartilage repair. It maintains the flexibility of ligaments and tendons. It even helps regulate how your body stores fat, which affects how you move and how your joints sustain pressure. But after menopause, estrogen levels drop dramatically. And by the time a woman reaches 60, estrogen is often at its lowest point. Without its protective effects, joints become more vulnerable to inflammation, stiffness, and wear. Another difference lies in the structure of the female body. Women naturally have looser ligaments compared to men, something that helps with childbirth but doesn't do any favors for the joints later in life. Looser ligaments mean less stability around the knees, hips, and shoulders. I've had many female patients tell me they feel like their joints give out or shift more easily. That instability forces muscles to work harder and creates additional stress on cartilage. Over time, that added pressure becomes pain. Bone density is another key factor. Women lose bone mass faster than men, especially after menopause. When bone density declines, the bones that form the joints don't support weight as effectively, and the surrounding tissues take on more strain. Even small losses in bone strength can lead to increased pressure on cartilage and greater friction inside the joint. There's also something many women don't realize until I explain it during an appointment. Hormonal shifts after menopause change the way fat is distributed in the body. Weight that once settled in the hips or thighs often moves to the abdomen. That shift alters posture and gait. A change in how the body carries weight, even a subtle one, can push the knees inward or tilt the pelvis differently. Over years, this altered movement pattern intensifies joint pain, particularly in the knees, hips, and lower back. On top of that, many women spend decades doing physically demanding work that often goes unrecognized. Carrying children, lifting groceries, long hours standing or walking, household chores, cooking, cleaning, caregiving, bending, stretching, reaching. These responsibilities may seem routine, but they add up. They load the joints, especially the knees and hands, with repetitive stress that accumulates silently until it shows up as pain later in life. I always tell my female patients, your body remembers everything you've carried. And for many women, that includes far more weight, emotional and physical, than they ever give themselves credit for. All of these vectors blend together into a single, unavoidable truth. Joint pain in women after 60 is not random. It's not imagined. It's not just aging. It's the natural result of hormonal changes, anatomical differences, lifestyle patterns, and decades of accumulated responsibilities. But here's the part I want you to hold on to. Understanding why your pain is worse than a man's is not discouraging. It's empowering. Because when you understand your body, you understand how to help it heal. You understand what changes matter most. And you begin to see that relief is not only possible, but expected when you give your joints the support they've been asking for. Hidden medical causes. Doctors often don't have time to explain. Now that we've explored the biological and lifestyle patterns that gradually shape your joints over the years, I want to shift our attention to something just as important, but often overlooked: Many seniors come to me believing their joint pain is simply old age, but that explanation hides a long list of medical conditions that quietly intensify pain, stiffness, and inflammation. These are issues most doctors know well but rarely have the time to fully explain during a short appointment. So I want to give you the understanding you deserve, because when you know what's happening inside your body, you gain the power to make better choices for your health. One of the most common medical causes behind joint pain after 60 is osteoarthritis. This condition affects more than half of adults over 60, and yet many people don't truly understand what it means. Osteoarthritis is a slow breakdown of cartilage, combined with chronic inflammation and changes in bone structure. It doesn't appear all at once. It develops silently over years, even decades, until the damage becomes noticeable through pain, swelling, or stiffness. For many of my patients, the moment they understand that osteoarthritis is a gradual process, not a sudden failure, they feel a sense of relief. Because once you see the timeline, you realize there's room for healing and support. Then we have rheumatoid arthritis, a condition many seniors mistake for just getting older, because the early symptoms look similar. But rheumatoid arthritis isn't caused by wear and tear. It's caused by the immune system mistakenly attacking the joints, leading to swelling, heat, and sometimes deformity over time. It's an autoimmune disease, and when caught early, it can often be controlled effectively. I can't tell you how many times I've had to gently explain to a patient that their pain wasn't their fault or their age, but rather an overactive immune response that needed proper care. Vitamin D deficiency is another hidden culprit. It's astonishing how common it is among seniors. As people age, the skin becomes less efficient at converting sunlight into vitamin D. Many older adults spend more time indoors as well. Without enough vitamin D, bones weaken and muscles lose strength, which forces joints to take on more strain than they should. I've seen patients whose joint pain decreased dramatically simply by correcting a vitamin D deficiency. Sometimes the solution really is that simple. We also need to talk about metabolic inflammation. High blood sugar doesn't just affect your energy or your pancreas. It damages the lining of your blood vessels, interferes with cartilage repair, and increases inflammatory chemicals inside the joints. Many people with prediabetes or diabetes experience joint pain as one of the earliest warning signs. When blood sugar is consistently high, it becomes harder for cartilage to recover from daily stress, and pain slowly builds. Thyroid issues are another silent player in joint health. When the thyroid slows down, the entire body slows with it, including metabolism, circulation, and tissue repair. This can lead to stiffness, swelling, and muscle weakness, all of which increase joint discomfort. A sluggish thyroid is far more common in older adults than most people realize, and it often goes undiagnosed for years because the symptoms are subtle and easily overlooked. When you begin to consider all these medical conditions together, a clearer picture forms. Joint pain isn't a simple story. It's a layered experience shaped by biology, hormones, lifestyle, old injuries, and deeper medical factors that influence your joints every single day. What feels like sudden pain at 60 is often the final chapter of a story your body has been writing quietly for decades. But the good news is this: once these hidden causes are understood, they can be managed. There are steps you can take, treatments you can explore, and habits you can build that help your body regain balance and strength. And that brings us to the part most seniors find the most hopeful: the solutions. The real, practical, effective tools that help reduce pain and restore movement. Doctor-recommended solutions that actually work. Now that we've uncovered the hidden reasons why joint pain surges after 60, let's turn to what I know many of you are waiting for: the solutions. Not the complicated ones, not the ones that require expensive treatments or endless appointments, but the practical, real-world strategies that have helped thousands of my patients regain strength, comfort, and mobility. Every recommendation I'm about to share with you comes from decades of experience, simple scientific understanding, and stories of seniors who turned their pain around with patience and consistency. One of the most transformative tools is strength training. I know that word scares some people, but strength training for seniors doesn't mean lifting heavy weights or doing intense workouts. It means small, controlled movements that build the muscles supporting your joints. When muscles weaken with age, the joints carry more weight than they were designed to handle. But just 10 to 15 minutes of gentle strengthening each day gives the joints the support they've been crying out for. I've seen patients in their 70s and 80s who thought improvement was impossible suddenly walk with ease again simply because their muscles finally had enough strength to do their job. Another powerful solution lies in the foods we choose. Inflammation is at the heart of so much joint pain, and the diet can either extinguish that fire or pour gasoline on it. Foods rich in omega-3s, like salmon and sardines, help calm inflammation. Turmeric, ginger, leafy greens, berries, and olive oil nourish the body and reduce the chemical signals that trigger joint swelling. I often tell my patients, your joints feel what you eat, and when they start adding these soothing, anti-inflammatory foods to their meals, they often report less morning stiffness and more fluid movement throughout the day. Hydration may sound too simple to matter, but for joint health, it's absolutely essential. Your cartilage needs water to stay soft and resilient. Synovial fluid, the natural lubricant in your joints, depends on hydration as well. Many seniors go half the day without drinking water and don't realize that their cartilage is literally drying out. When they begin drinking consistently, even small increases in hydration help restore flexibility and reduce friction inside the joints. I encourage my patients to sip water throughout the day rather than gulping it all at once. The body responds far better that way. Movement is another key pillar of joint health, but not just any movement, the right movement, the kind that strengthens, nourishes, and protects the joints rather than stressing them. Swimming is one of my favorite recommendations because it allows full-body movement without pressure. Cycling is gentle on the knees and hips while building strength. Tai Chi improves balance and coordination, reducing the risk of falls. Chair yoga opens stiff joints while keeping the body supported, and gentle mobility exercises, even just a few minutes a day, keep the joints lubricated and awake. The body thrives on motion. Joints that move stay alive. Joints that rest too long become stiff and painful. Heat and cold therapy are simple, yet incredibly effective. Heat relaxes tight muscles and improves blood flow, making morning stiffness easier to manage. Cold reduces swelling and numbs sharp pain after activity. I've taught many patients to use heat first to loosen the joint, then cold afterward to calm inflammation. It's an easy routine that creates meaningful relief. Footwear is another area people often overlook. The feet are the foundation of the body, and when that foundation is unstable, the knees, hips, and back all compensate. Good arch support improves alignment all the way up the body. Many seniors discover that once they begin wearing shoes with proper cushioning and stability, their knee or hip pain reduces dramatically within weeks. Weight control is also essential, not from a place of judgment, but from a place of compassion and understanding. The knees, hips, and spine carry the full weight of the body every day. Even small changes in weight can significantly reduce joint stress. I encourage gentle, sustainable habits rather than restrictive diets. More vegetables, more water, fewer processed foods, and more movement. Slow progress is still progress, and for the joints, it can be life-changing. Supplements are another helpful tool when used wisely. Vitamin D3 strengthens bones and supports immune regulation. Omega-3 acids reduce inflammation naturally. Glucosamine and chondroitin help nourish cartilage and reduce stiffness for some people. Collagen peptides support the connective tissues that keep joints stable. I always remind my patients that supplements are not magic, but they can be powerful allies when combined with movement and diet. Sleep is perhaps the most underrated part of joint health. The body's repair processes are strongest at night. When sleep is disrupted or too short, inflammation rises and tissue recovery slows. Many seniors find that their joint pain improves significantly once they create a healthy sleep routine. A consistent bedtime, a cooler room, reduced screen time, and gentle stretching before bed can all support deeper rest. And finally, one of my favorite strategies: movement snacks. Instead of exercising once a day and sitting for hours, I encourage my patients to move for just 2 minutes every hour. Roll the shoulders, stand up, and sit down gently. Stretch the hands and ankles, walk to the kitchen. These tiny moments of movement nourish the joints throughout the day and prevent stiffness from building. The biggest lesson I've learned after 30 years of caring for older adults is this: small changes, done consistently, create extraordinary results. You don't need perfection, you just need commitment. Your joints are waiting for you to support them in simple, steady ways, and when you do, they respond beautifully, no matter your age. Emotional reassurance with expert experience. As we reach the final part of this main section, I want to speak to you not just as a doctor, but as someone who has walked alongside thousands of older adults who feared their joint pain meant their best years were behind them. I've heard the worry in their voices, the frustration in their stories, and the exhaustion that comes from waking up every day in discomfort. And if you're listening to this right now, feeling that same heaviness, I want you to know something deeply important. Joint pain does not mean your body is failing you. It means your body is asking for help in the only language it has. Pain is not a punishment. It is communication. It is your body calling your attention to imbalance, misalignment, inflammation, or wear that has gone unaddressed for too long. And the moment you begin giving your body what it needs, even in small amounts, it responds. It always responds. I've seen transformation in people in their 60s, 70s, even their 80s. I've watched seniors who could barely walk to the mailbox regain their confidence with gentle strengthening. I've seen women who thought their joint pain was permanent find relief after improving their sleep or adding just a few anti-inflammatory foods to their diet. I've witnessed men who believed they were too old to heal suddenly move with greater ease once they hydrated consistently or corrected a vitamin deficiency. These aren't miracles. These are the natural abilities of the human body. Your joints remain responsive to positive change at any age because the body is designed to adapt, repair, and support you, even when you doubt it. The key is consistency, not intensity. You don't have to push through pain or force yourself into difficult routines. Gentle, steady habits are far more powerful. 2 minutes of movement every hour, a short walk each day, a little more water, a little more strength building, a little more attention to posture. These small choices add up in ways that surprise people. The body blossoms under kindness and patience, and perhaps the most encouraging truth of all is this: your future doesn't have to look like your past. The pain you feel today is not a life sentence. Your joints can improve. Your comfort can return. Your mobility can grow stronger. I've seen it happen over and over, and I believe it can happen for you too. You deserve a life where movement feels natural and joyful again, and you have far more influence over that outcome than you may realize. As we come to the end of this journey together, I want to remind you of a truth that often gets lost in fear and frustration. Joint pain after 60 is not random, and it is absolutely not hopeless. Your body isn't breaking down. It's communicating. It's asking for care, understanding, and steady support. When you begin to listen with patience instead of worry, everything changes. One of the greatest lessons I've learned from my years caring for seniors is that the human body is far more resilient than most people believe. It heals, it adapts, it responds to even the smallest positive change, whether you're in your 60s, your 70s, or your 80s. I've watched people at every age rediscover ease in movement and strength in places they thought were gone forever. Your body remembers how to recover. It just needs your partnership. And in that partnership, compassion matters. Your joints have carried you through a lifetime of memories, responsibilities, challenges, and joy. They've supported you through decades of work, family, and everyday living. They're not giving up on you. They are simply asking for alignment, hydration, gentler movement, better posture, calmer inflammation, and regular strengthening. Small acts of care create big waves of relief when done consistently. So as you move forward, I encourage you to hold on to the power you may have forgotten you have. You can choose movement that supports healing. You can drink more water and feel the difference. You can straighten your posture a little each day. You can fill your plate with foods that comfort your joints instead of inflaming them. You have far more control than you think, and improvement is possible at any age. If this video helped you understand your body a little better, stay curious, stay consistent, and stay connected with this community. Share this video with someone who needs encouragement today, and subscribe to Senior Health Daily so we can continue this journey of strength, healing, and hope together. Your best years can still be ahead, and your body is ready to walk into them with you.